There are really only two kinds of people in the world. It doesn't matter what country you live in, whether you're male, female, or somewhere in between. It doesn't matter how old you are. Nothing matters. There are only two kinds. Those who have had kidney stones and passed them, and those who have not. If you've passed a kidney stone, you know helpless public humiliation. You also know, if you've been to a hospital in the midst of the episode, lack of compassion, embarrassment, and oftentimes misdiagnoses. Kidney stone pain, any mother will tell you who has had one, is nearly identical to labor in intensity, severity, pain scale, however you wish to describe it. I've never given birth, but I'm satisfied that I understand the experience. I've only passed 2 stones, 2 years apart. I have a friend who had hundreds of stones, who was in convulsions and had to be on 2 bags of morphine in the hospital while he passed them. There are stories of ureters being torn by lodged stones. There are stories of kidneys suffering temporary and sometimes permanent damage from stones. This is no joke. But the medical community's system of triaging emergent need must change. And here's what I mean by that. Apparently, when a patient presents in acute pain, vomiting, writhing, because there's no immediate means of assessing whether or not A, the pain is real or imagined, the pain is faked or genuine, and whether the source of the pain is in fact drug dependency, withdrawal. The medical community argues that such a patient cannot be triaged at the top of the hierarchy of need. In simple terms, this means that heart attack and stroke patients and auto accident and other trauma victims, nobody would argue, are placed at the top. I'm not arguing that. But kidney stone pain and its expression is determined to be non-life threatening. Such patients, therefore, are left to sit, writhe, crawl, and otherwise deal while they wait and watch sometimes 4 or 5 other patients enter emergency treatment ahead of them. Suppose the medical community were to develop a test to rapidly diagnose the presence of a passing stone. A woman in acute labor pain would not be left in an emergency waiting room indefinitely. Kidney stones are not determined to be life-threatening. But ask anyone who's lost a kidney or a ureter as a result of their damage. Time to step up and address this. If you work in this field, lean in. We're talking to you. There are 2 kinds, those of us who've had them and those who have not. Listen to us. We're writhing in pain and vomiting in your waiting rooms. We're causing trauma for all the other patients in the waiting room who have to sit and listen to us. It's time to address it. Tomorrow morning, you could wake up passing a stone. Then you'll take action, if you can even move. Thanks.